My name's Kumar. I'm an abdominal body imaging radiologist with MIC. I've been with MIC for 24 years, and I practice in the areas predominantly of ultrasound, CT, and MRI. What made, the child in me decide that this was something I wanted to pursue? I have an aunt who's a nurse and an uncle who's a physician, and those are the medical people in our family. I think I admired how important their job seemed to be and how respected they were. And that kid in me said that seemed something worthwhile. And that's what I think started the seed. And then, you grow and you realize, this is something I enjoy. I enjoy these areas of study. I enjoy being with people. I enjoy helping. I wanted a job that mattered. It really did. And this seemed like something that would matter. Not just to me, but to my community. It felt like something important that needed to be done. And I felt like I could do it. And I had that belief that I could do it. And I wanted to chase that. It's hard because nothing else entered my mind. And it was one of those things that I fixated on and I just pursued. Radiology was not in the picture. I was for sure going to be, your typical family doctor. I think most kids, when they have an image of what a physician is, their first thought is the doctor that took care of them. And it wasn't until medical school that I realized what that world was in the dark rooms in the bottom of the hospital. And I liked the puzzle-solving aspect of radiology. I like putting the pieces together, putting the patterns together, coming up with an answer that made sense in the context of the patient, and then sending it to someone else to figure out what to do about it. That was the part of the medicine that I enjoyed, and it's been great. I think, like anything, we are treating a whole spectrum of people. Our practice should reflect that spectrum of people. We should have caregivers and healthcare providers that cover all of those bases. You want to see those faces that you recognize when you're in a vulnerable state, when you're not feeling well. And that's important. I think that it would be a travesty to have only women practicing in the health field, and I think it would be a travesty to have only men practicing in the health field. You need all of us. We each bring our own experiences, we bring our own backgrounds, we bring our own priorities and our own values, and the community that we serve has all of those as well. It takes a toll. It requires a lot of personal commitment. It is challenging, but every day is worthwhile. I don't ever have a day where I didn't feel like I made a difference. It's very few jobs, very few things that you can do in your life where every day actually can matter. If you don't lose sight of that part of it, and if that becomes the central focus of why you're doing it, it's a rewarding profession. It is. Not easy, but rewarding, really rewarding. It's not going to be easy every day, and nor should it be. That's the reality, nor should it be. You're doing a job, you're seeing people at their worst, and it requires you to be at your best the whole time. Not easy, but when it works, it makes it worthwhile.